Hi, hope you are doing well. Welcome to Dental Education Hub YouTube channel. In this video, we will discuss the 5 high-risk groups in which the new silver fillings should be avoided. The Food and Drug Administration, which is a US federal agency, it recommends that in the high-risk populations, the new silver fillings should be avoided. So let's talk about what are those 5 high-risk groups. Group number 1, children, especially the children who are less than 6 years of age. In these children, the silver fillings should be avoided. Group number 2, pregnant women or those who are planning to be pregnant. In this group also the new silver fillings they should be avoided and the alternative materials they should be used. Group number 3, nursing mothers or in the breastfeeding mothers also the new silver fillings they should be avoided. So group number 4, in patients with existing neurological disease or kidney dysfunction. In these patients, the new silver fillings they should be avoided. Last, group number 5, the mercury, silver, copper, tin and zinc, they are the main ingredients of the dental amalgam. The patients who have known sensitivity to one of these elements, in those patients, silver amalgam fillings, they should be avoided. Thank you very much for watching this video. If you have any questions, feel free to ask in the comments below. We will be looking forward for your feedback. Thank you and stay blessed always.